Hi there, and welcome again to another small bite of eCritical. We're going to talk today about how to do the admission documentation. Now, this is the documentation that's required for the attendings and doesn't need to be done by the residents. A lot of the admission forms will be replaced. Any that you might have been doing, especially with the minimum data set, will be replaced by this form. And this is the form that we use for a large part of our severity scores, so that we can track the severity of illness for patients in our ICUs. In order to enter in an admission, you simply just click on the admission button in the upper row, and it will bring up a form for you to fill out. The admission form ideally should be filled out within 24 hours, and the time is automatically stamped to the date of the patient's admission. So there's no time indicators at the top here. Now, for this patient, we're going to use the information that's in the workbook to document our initial admission assessment. So if you want to follow along with in the workbook, is in the online learning material, and starting on page 6. So for this patient, we're going to first start with the GCS, and the patient has a GCS that's 2 to eye opening, incomprehensible words, and withdraws to pain. The acuity scoring have to answer a number of questions, but again, like the other forms, they're primarily drop-down driven, and if you have any questions, you can always click on the underlined section and it will actually give you more information, such as patient classification here. Gives you a number of all of the different classifications for this patient, for this severity score, acuity score rather. So in this case, the patient will stay as a medical patient, non-operative, not planned admission within the last 12 hours, and not readmitted to the ICU from current admission. Patient was on vasoactive medications before they came in. Did not have a respiratory infection, and did not have a nosocomial infection, and didn't have acute renal failure. Again, to show you what they mean by acute renal failure by just clicking on the underlined section. Okay, going to the acute diseases processes present on admission, cardiovascular sections. I'm going to say hemorrhagic shock, again, there's a long list of helpful information if you like it. Any acute digestive problems, we're going to say none. Acute hepatic process, the patient was in liver failure. And then acute neurological, you'll select coma. Stupor obtunded. And again, you see there's also a little bit more information on the right-hand side for you to fill in. For you to review if you have any questions about what they're trying to get at with this. Now, the chronic health conditions, which you'll recognize as part of the Apache scoring, we're going to say no, 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 but this patient has cirrhosis. They were diabetic with hepatic failure. They were non-immunosuppressed. Didn't have leukemia or a lymphoma or a cancer. Now, the Apache scoring system is actually kind of nice, because you'll notice there's a lot of empty space down here, and that's because this is only going to have you fill in as much information as necessary in order to answer the question of what is the admitting diagnosis. Now, this is the admitting diagnosis section. Okay, so we're going to select, in this case, the patient was non-operative, And you see how a number of questions will come up to answer as you're going through. Did not suffer cardiac arrest. Is not related to sepsis. Is related to trauma? No. Is it due to a myocardial infarction? I'm going to say no. Now, so this system is gastrointestinal. Let's see here. Let's say this case. Bleeding from esophageal varices. And there's the diagnosis in there. And you just click Save and Close. And the form is done. And that's all there is to it. So that's how easy it is to enter in the admission form. Next we're going to talk about how to do the daily GCS.